Cranial nerves, with its functions, examination, and abnormal signs. Olfactory nerve, cranial nerve 1. Functions, smell, examination, identification of a familiar odor. Example: coffee, orange, tobacco with one nostril at a time. Abnormal sign, partial or total loss of smell. Altered or increased sense of smell. Optic nerve, cranial nerve 2. Functions, sight or vision. Examination, visual acuity, reading with one eye covered. Peripheral vision, detection of objects or movement from the corner of the eye with the other eye covered. Abnormal sign, visual field defects, loss of visual acuity. Color blindness. Oculomotor nerve, cranial nerve 3. Functions, movement of eyelid and eyeball, constriction of pupil, and lens accommodation. Examination, follow the examiner finger which moves up and down and side by side, keeping the head in mid-posture. Abnormal sign, squint, ptosis, diplopia, pupil dilation. Cochlear nerve, cranial nerve 4. Functions, movement of eyeball upwards. Examination, follow the examiner finger which moves up and down and side by side, keeping the head in mid-posture. Abnormal sign, squint, diplopia. Trigeminal nerve, cranial nerve 5. Functions, mastication, sensation for eye, face, sinuses, and teeth. Examination, facial sensation test. Patient asked to clench his teeth. The examiner palpates masseter and temporalis muscle. Abnormal sign, trigeminal neuralgia, loss of mastication, sensation of eye, face, sinuses, and teeth. Abducens nerve, cranial nerve 6. Functions, movement of eyeball into abduction and control gaze. Examination, follow the examiner finger which moves up and down and side by side, keeping the head in mid-posture. Abnormal sign, gaze palsy. Facial nerve, cranial nerve 7. Functions, facial movement, sensation, and taste for anterior 2/3 of tongue, secretion of saliva and tears. Examination, test ability to move face. Close eyes tightly, wrinkle brow, whistle, smile, show teeth. Abnormal sign, Bell's palsy. Loss of taste, loss of ability to close eyes. Vestibulocochlear nerve, cranial nerve 8. Functions, hearing and balance. Examination, examiner rubs index finger and thumb together noisily beside one ear and silently beside the other. Patient identifies the noisy side. Abnormal sign, tinnitus, deafness, vertigo, ataxia, nystagmus. Glossopharyngeal nerve, cranial nerve 9. Functions, sensation and taste for posterior 1/3 of tongue, swallow, salivation, regulation of blood pressure. Examination, swallowing, evoke the gag reflexes by touching the back of the throat with a tongue depressor. Abnormal sign, loss of tongue sensation and taste. Reduced salivation. Dysphagia. Vagus nerve, cranial nerve 10. Functions, regulation of internal organ functions, such as digestion, heart rate, and respiratory rate, as well as vasomotor activity, coughing, sneezing, swallowing, and vomiting. Examination, lie on your back on the ground. Look with your eyes to the right until you sigh, swallow, or yawn, and then repeat on the other side. Abnormal sign, abnormalities of esophageal motility, tachycardia, fast heart rate, bradycardia, or slow heart rate. Palatal and pharyngeal paralysis, gallbladder emptying. Accessory nerve, cranial nerve 11. Functions, motor to soft palate, larynx, pharynx, trapezius, and sternocleidomastoid. Examination, rotate neck to one side and resist flexion. Adati contract sternocleidomastoid. Shrug shoulders against resistance. Abnormal sign, paralysis of innervated muscles. Hypoglossal nerve, cranial nerve 12. Functions, tongue control and strap muscle of neck. Examination, stick out the tongue. Push tongue in a left and right side of cheek. Abnormal sign, dysphagia, dysarthria, difficulty masticating.